figured we would start with a little poll. Now that everybody's warmed up, why don't we ask a question? So what is your level of experience with PEOs? Maybe you're somebody that competes with them. Potentially you have no experience with PEOs, you're new to that PEO market, or maybe you're somebody who partners with and already sells PEOs. We know that some PEOs are partnering with brokers, that's more common. So tell us again, what is your level of experience with PEOs? And we said it a couple of times there, so go ahead and drink.
The drink, yeah, Diane's already on it. Looks like we've got about 70% of the vote in. We'll give everyone just a couple more minutes. Have your drinks, get your votes in. All right. So we've got 28%, Chris, that compete with PEOs, 42% have little experience with PEOs, and 30% partner and sell PEOs.
Excellent. Really good mix of different experience levels. And the biggest majority is those that have little experience with PEOs. So I think, Paul, your first couple of slides here are really relevant. Why don't we define what a PEO is?
Sounds good. So that's going to be hard to follow that kickoff, but I think it's warmed everybody up, right? So I'm super excited. Hopefully this won't be that boring. Yes, nice job, Diane, on the chat. Okay, so you guys are going to get ready to drink because I'm going to say PEO a few times here. But what does a PEO stand for? Professional Employer Organization. There are close to 1,000 PEOs actually out there in the marketplace running around, and especially for you brokers that are competing against PEOs, right? They're always knocking at the door, and they represent about $275 billion in revenue. So they have quite a good business going on, and there are about 200,000 employers that are insured. So, from my perspective, there's a lot of business out there for the taking, and or consulting with to see whether they're ready to come off of a PEO. So how do they deliver services? Typically, it's a co-employment. Well, not typically, it is a co-employment arrangement, meaning that the employees of your clients actually reside on the tax ID number of the PEO, the federal tax ID number. And then you could change the slide. So what are the services that a PEO provide? Basically, the core services are payroll and tax filing, benefits, the health insurance and all the insurance lines, HR, basically tactical support, day-to-day HR, what we call ASO, administrative service, onboarding employees, offboarding, and then also workers' comp. There are several other sub services that they offer, but those are basically the 4 core services that are provided on the PEO platform. The employees reside basically in the middle between the employer and the PEO, sitting on the PEO's federal tax ID number. So the value proposition and the ROI that the PEO sales reps, are selling are the payroll and tax management, applicant tracking and recruiting, onboarding new employees, open enrollment, benefit administration, management, expense management, so on and so forth. And the reason why this value proposition over the last 10 years has become so sort of significant to employers is because payroll is not just payroll anymore. It's not just cutting checks and paying taxes. It's managing this employee life cycle. And I'm sure most of you by now have heard maybe the word HCM, human capital management. from hire to fire, resume to retirement. There's a lot of coined HCM life cycles out there. And what's happening is, employer has to deal with this enhanced burden managing this life cycle, right? So it goes from payroll to onboarding of employee. The moment that the employee submits their resume, what is the impression that the employee has with the organization that they're applying to, right? How efficient is that employer in terms of onboarding them into their company, educating them on their culture, bringing them into the mix? That onboarding process is very important, and especially in today's day and age, with the millennials coming into the workforce. Their expectation is not to complete any paperwork. They don't want to complete any. They haven't been on paper. They've been working on laptops and for pretty much their whole life. So from the onboarding to the employee benefits education and management and all the ancillary lines, to HR compliance to offboarding. So that's sort of the picture of what employers are dealing with and managing right now. And then, and in addition to sort of, high or very expensive increasing health insurance premiums, the PEOs have been very effective in selling on the ROI of the PEO, the cost savings, managing the HCM cycle with an HCM system, a human capital management system that provides relief from this burden, right? So that's sort of what we're all up against, when employers decide to go to a PEO and why they go, right? The pain points that are associated with this HCM life cycle. We can go to the next slide. So what I've seen from my experience and in the last few years, I've seen that, the PEO promise, that value proposition, that, it's not quite as good as, walking on the beach that the PEO sales rep, touts. And things begin to break down. So maybe it's the service, maybe the client's not using all of the modules from a technology perspective. And what's been happening a lot is that the health insurance, the gap between the health insurance cost has been shrinking, right? So there are a lot of groups out there that may be able to go direct and to the insurance carrier and get possibly better rates. And especially if they are familiar with the difference card, or if you as the broker are able to introduce the difference card, they can save a significant amount of money and maintain the same benefits. So the point here is that at some time, the promise breaks down, the value proposition becomes less attractive, and we need to figure out a way how to replicate and manage that human capital management life cycle for them, right? When they're ready to come out. So I think I'm going to jump into a case study next, right, Chris? Yeah, so this is a case that we did for 1-1 with a broker who was referred in by the accountant. Demos, his average age of the group was about 42. The payroll experience, meaning that they weren't the most sophisticated group. They had, one person managing pretty much everything. They didn't have like a full staff of HR and controller and CFO. So infrastructure wise, they were somewhat limited, and that's probably why they were attracted to a PEO originally. Manufacturing, gray collar from a workers' comp perspective, and really they were not that satisfied with their benefits. So, the biggest, I think maybe one of the attractions to go to the PEO was saving on the health insurance and the overall package. They weren't really enamored by it. That's what we pulled out of our discovery pretty early on. So when we went through the discovery process and got into the analysis, we set some objectives for the client. The client gave us some objectives for the broker, for us, and like for the difference card, right? They wanted to improve their administrative support. They weren't really getting what they felt they deserved from a client service perspective. They wanted to really dig into the PEO fees and understand what exactly they were getting charged, even above and beyond the admin fee. So, what is their true workers' comp cost if they went directly, on the street? What would their new SUTA rate be as a new employer? They didn't really understand anything about EPLI, right? So they really wanted to dig into and have an analysis done. And so that's right up our alley. The benefits, they wanted to maintain at least, maintain the benefits or improve upon. And they had a pain point around their general ledger, which is the job costing. They wanted to be able to track that and basically pull it into their accounting system. And so obviously every client wants a decreased benefits cost, right? They wanted to maintain or decrease their workers' comp cost. And again, they wanted to improve their accounting integration. So that's what we were tasked with going in. So it really wasn't just hey, save us money on health insurance. There was, as we dug in, we did a consultative, comprehensive, macro look at several different things that were going on with this company. So we went through our fee analysis, and from an admin fee perspective, it wasn't a per employee per month flat cut and dry situation. But at the end of the day, we were able to identify about $79,000 in admin fees for 55 employees. With the difference card, we were able to match exactly high and low plan design. The broker was able to do that. We saved them $116,000 first year and reduced the employee contributions. We saved them going direct on the workers' comp. The broker brought in a workers' comp relationship that handled that. We stayed on board ongoing for ASO support. So day-to-day support, supporting the broker and the employer. And the client wanted to go with ADP, Workforce Now. So that's what they wanted to go with. And they wanted to put in place a benefits and onboarding platform. And the general ledger integration was a big driver here. So we were able to accomplish what they wanted on the general ledger with the Workforce Now platform. And the broker did really, really well on this. Wrote the health insurance, the dental, the life, STD, LTD, the vision, took over the 401k, and we paid them a little referral fee on the payroll side. They were able to save about, the group was able to save about $200,000. And I would say that it was a win-win-win. It was it was just win for the client, it was a win for the broker, it was a win for the difference card, and it was a win for us. And so I'm going to turn it over to Chris, right? And then I'm going to come back towards the end. I'm going to dig in a little bit, just give you a little bit of taste of sort of the process that we went through, the 4-step process that we went through to kind of come to this, win-win-win situation.
All right. Thanks, Paul.
Yeah.
And Paul, we do have a few questions in the Q&A box. I think as we get to the end of this discussion, we'll address some of those questions. One of them I just see on the top here is, did this broker have the client when they were in the PEO. And no, this was a new client for the broker that we were jointly working with on this account. So they were able to pick up all of this as new business. They hadn't placed the business with the PEO, and they were able to pull it all out and place it with private carriers, private payroll without the PEO. And that was a great revenue opportunity for that broker that we worked with. So there are situations where difference card does work within a PEO. That is one of the strategies we use with the broker partners that we work with, but that's not always the right fit. And what we've seen is as a group starts to grow, they eventually get to the point where if they stay within the PEO, they are leaving a lot of money on the table between the overinflated payroll admin costs, sometimes the workers' comp costs, and even the health insurance costs can get inflated. Now, when you talk to a PEO rep, and a lot of times when the group is going into the PEO, they're doing it because they're getting really competitive health insurance pricing. That's one of the typical reasons a group will go in. They're getting the national account type pricing for a small group market. Well, as Paul mentioned, we've seen that pricing spread really has shrunk over the past few years. And we're now at a point where a lot of these PEOs, the pricing is there where you can take them out, get a competitive decrement using the difference card, and make up the differences, make the benefits the same as what they were before. So this example is the same group that Paul was talking about 55 employees on payroll. They had a very high participation rate on the health insurance, a high employer contribution. So they had about 47 of the 55 people on the health insurance plan. And this is where most of the employees were enrolled in today. They had a $30 primary care, $50 specialist, and their benefits cost was about $600,000 for that plan today. When we left the PEO, when we went to the market, the broker priced out several different carrier options, and the one they ultimately went with had a $200,000 reduction in premium to buy this plan in the middle with the higher copays and the higher deductibles. So that's a way to get competitive versus a PEO, right? Instead of matching the apples to apples quote, which is the starting point. The broker first said, let's try to match current. And then to save more money, we reduced the plan, went to high copays, high deductibles, got a big discount on the premium, but the difference card was there to make up all those changes in benefits. So we're swiping this card for $30 at the doctor's office or 50% of these prescription copays. And that brought the employees back to the same or better benefits. They actually improved the primary care, brought that down to 10. They kept the specialist copay the same. They matched the deductible and then actually gave an improved prescription drug plan as well. So I want to show you the numbers behind this example. And this was the situation. One group getting a 15% rate increase. So that health insurance cost was getting to a point where it was not competitive to stay within the PEO. They were over $600,000 in that segment. Instead, they went outside of the PEO, bought that plan with the higher copays, higher deductibles, got a $200,000 savings off of the fixed health insurance premium. But that was buying the plan with the high copays and high deductibles. And that's where difference card came in. We supplemented back to make up all the differences in copays and deductibles. And that cost the group about $100,000 in claims and administrative expenses. So the all-in cost was $558 for this group, which was still 5% savings off of their current expenses and about a 20% discount off of their renewal. It's $116,000. Now, one of the reasons Paul and I are talking to you at this period in the year is that there happens to be a very large PEO that is releasing all of their renewals in the next week or so. Some of them are already out there for June 1st. And then there are other PEOs that renew October 1st and some that come up for 1/1 as well. So this is a good time to be hunting. If you're talking to a group that's in a PEO, especially if they're in that ADP Total Source PEO, you know they're getting their increases now. And when there's pain, that's where there's potential for opportunity to save that group money. The next step is making sure we match benefits. So difference card and our team does a benefit analysis to make sure we're matching the current plans. Some of these PEO options get very complex. I've seen groups with 5 and 6 plan options. And Difference Card can deliver those multiple plan options back to the group. In this situation, it was pretty simple. It was a dual option. They had a PPO copay plan and a PPO HSA plan. So we kept them in that same environment. Copays for the high plan, HSA plan for the low option. We just went to these $6,000 deductibles in order to substantially lower the premiums. And then on the far right, you'll see Difference Card made up all the changes. So it's the same out of pocket and sometimes some better benefits, lower primary care, same deductibles. And we kept it HSA compatible for that low plan and actually consolidated all of those consumer directed items all onto the Difference Card. So we put the FSA for the copay plan on the Difference Card. We put the HSA, right, the health savings account, consolidated with the Difference Card. So employees put their money away first if they were on that low plan, and then Difference Card kicked in for the back end portion of the deductible. We always do a long-term projection, especially when you've got a lot of savings on the table like this. You want to show the client that it's not just about that year one savings, but there's 5 years in this analysis and substantial compounded results, right? Instead of them getting that increase next year off of the $600,000 premium, we've really reset the starting point to the 400,000 range. And now you've got substantial savings year over year, over $600,000 over a 5-year period for this customer. So the savings is great, and that's a great way to get groups to consider leaving the PEO, but there are a lot of complexities involved, and that's where Paul's team at Payroll Mart does a great job of helping you as the consultant and the group to navigate the steps of getting out of that PEO. So Paul, why don't you take us through what happens when you get to that getting close step and you're almost there and you're showing them what are the next steps.
Yeah, thanks, Chris. Yeah, so there's some good questions that came in on the Q&A and chat that I'll address as well. But when we went through that case study, that was a group, and this is probably pretty much the majority of the time when we're brought in. The broker's already done a good job at qualifying the company, in terms of where they are and maybe their appetite for coming out of the PEO, right? They've had some conversations, but we generally would like to get involved in the discovery process. And for me, it's sort of a paradigm shift, because in our discovery process, we want to gather as much information as possible. And ideally, you've already possibly as the broker asked for census data, right? Or you might have already received it. And to make the processes streamlined as possible is the more information we all gather as a team, right? So if you think about the components that we spoke about earlier on in the presentation, the health insurance broker, right? You might be also licensed in property and casualty, right? So you might be serving as the workers' comp broker, right? The 401k might be embedded in the PEO. So all the payroll, we all need the same information, right? So the sooner we get that information, the census, the dates of birth, the salary, if you're putting in short-term disability and long-term disability, the workers' comp needs the job titles and the job descriptions and the class codes and the states. So the sooner we can get to working off of one single master employee census is my biggest sort of driving point. And that's where the paradigm shift is like, let's all come together, identify the team members, who's going to be handling the 401k, who's going to be handling the workers' comp, get that all out in the open, sort of in the discovery process. Chris and I were on a call. I mean, I think we had 6, I've been in this business 20 plus years. This is probably the first time we've ever been in a room virtually with like 6 really, really smart advisors, all, providing, going towards a common goal for this very large client we're working on. And it's rare that you can get all of us together and work aligned. So my point is during the discovery process, identify your team, identify the sophistication of the client. What kind of infrastructure do they have? What are their pain points? Again, who's going to be on your team doing what time of year it is, what's our timeline, what do we, if we're in September and we're going for a 1-1, or if we're now, in, March, we're probably looking at 6-1s, right? And that's, and then where does the payroll company selection, who has the client already spoken to in terms of like payroll sales reps? Where are they with that? So we're all aware of kind of the moving parts. Then we go into the analysis. And this is interesting because the time of year is very important. And, 1-1, we don't have to worry about the SUI and FICA restarts and that whole analysis part because everyone starts clean as of 1-1. But the key to the one, we have a SUI tool that we've created, and SUI is state unemployment insurance. So, the PEO, unless it's a self-reporting state, meaning that the client has to pay on their own SUI tax ID, most likely as a new employer starting for 1-1, they're going to get potentially a lower SUI rate, right? So identifying those admin fees, the service fees, what extra savings can be. So just to go back to that, you don't have to go back to the case study, but just to tell you, we saved them an additional $14,000 on the SUI new employer rates. That was not included on that, sort of on that overall savings. So that was like an added benefit. But to one of the questions in the chat is that, if we're a mid-year change, the SUI restart and the FICA definitely comes into play and needs to be disclosed to the client and or discussed with the client, in terms of what employees are going to have already paid into SUI, because there's thresholds, per state. If the company has multiple states, we had a company that we did that was in 16 different states coming out of the PEO. It was super complex. Section 125 savings, right, is the PEO paying and reporting the FICA on the gross, and are they charging, what is the PEO charging the client on, charging FICA on, versus what are they actually paying to the government on? So identifying that number is very important and can save the client a significant amount of money that a lot of people don't talk about. EPLI is very important to distinguish against the PEO's contract versus if they're going to go with an EPLI policy, claims incurred during the PEO, but the claim comes after they're out of the PEO. So these are all things that we're going to have to look at during the analysis. And and Chris mentioned that the difference card can work within a PEO. There might be a situation where we go through the analysis and it's best for them to go possibly to another PEO. Now, we don't necessarily do that. We align ourselves with a PEO to PEO specialist. I think he's actually on the call, and I can introduce you to him if you do need that. But we would work very closely with him. And if the broker agreed, like saying, hey, as a hedge or a safety, having a safety net, you may want to have that PEO RFP out there as well, right? So I know I'm belaboring this analysis part, but this is something that's very important to us, and I get very passionate about it. So, and there's other things, retirement plan, the time labor management component, general ledger, et cetera. And then once we get into implementation, ideally, we've been collecting information and getting information from the client through step 1 and step 2, and now we're off and ready to go for implementation. And the biggest hurdle that we find with implementation, and you guys all need to jot this down, is that when a client's coming out of a PEO, the first thing they need to do is provide proof of their federal tax ID number. I have literally like 5 companies that are ready to start, and they cannot get us proof of their federal tax ID number because they've been in the PEO so long. It has to be within the last 12 months. So the SS4 form or a letter from the IRS, a lot of our clients, the brokers are going to have the client call the IRS to get this letter to show most recent proof of the Fed tax ID. And then also registering them on the state tax ID level, on the SUTA, on the SUI and the SIT, the state income tax. We get involved in the data aggregation and then the integration. So if the broker puts in place a workers' comp pay as you go, we want to make sure that we're integrating with that workers' comp carrier. We integrate with the 401k, make sure that we're putting them with a payroll company that can integrate seamlessly on the 401k. So the report goes back and forth and it's a 360. And then we stay on board for day-to-day support, managed payroll, reporting, administrative support if the broker's not providing it. So that's my rant, but that's our 4-step process. I'd be glad to chat with you one-on-one to get into more detail on the restarts, but hopefully I answered that question for you. Thanks, Chris.
Paul, you went through some great information there. And as you can all see, this is not a simple process. There's a lot involved. That's really the value that Paul's firm brings, is that expert in helping us to unbundle all that is involved in a PEO. So it doesn't end here. We're going to try to answer as many questions as we can in the remaining time. If we can't get to any of them, feel free to reach out to us, sales@differencecard.com or support@payrollmart.com. And we'll certainly set up some follow-up time with each of you one-on-one to go through some of the specific questions and maybe opportunities that you all have. And if you've got a difference card rep already assigned to you, work with them, and we can always get Paul involved through the difference card consultant that you are assigned to. So Paul, why don't we start by going through some of these questions in the chat box, and then we'll get into the Q&A, and we'll see how many we can get through before we end here. Sound good?
Sounds good.
All right, so one of the first ones here is just about 401k. Let's say the broker does not have a 401k in-house. Paul, do you have partners you can refer them to?
Yes, I do.
So that's definitely one of the pieces.
Would that be more from the advisor? Would that be more from the advisor standpoint, or from, maybe the TPA or provider side? But yeah, we could, ideally on the provider TPA side, we'd want to go with a company that we could integrate with, and then plug in an advisor. Absolutely.
Great. There's an interesting question about the tax restart strategies. I think you did address some of that, right? If we're dealing with a 1-1 group, you don't have that problem. For these 6-1 ADP groups, I think it depends on the state. There are some states I've heard that you don't have to deal with the tax restart issue, and then others that you do have to do an analysis to see what that extra cost is going to be from a tax restart perspective. Paul,
exactly. On the state unemployment side, if the client is located in some of the self-reporting states, they're already paying on their own tax ID number, so it wouldn't be a restart. But if they are in the majority of states are not self-reporting, and when they come out, and it also depends on the threshold per state. So some of the states, like Florida, I think is like 7,000, so it's relatively low number. But yeah, you'd have to look at the different thresholds per state, and then look at the other thing to look at is the FICA. Especially if you have high earners in highly compensated employees, and you're far out into the year, they might have already paid in FICA, Social Security, and Medicare. It's the 7.65%.
All right, certainly a lot to consider on that topic, and you really have to look at it on a case-by-case basis. But I think, again, that's something that Paul can help you with. Next question was a difference card related question. Was the example we showed with the reinsurance involved? And it was. So that was a guaranteed savings solution. A lot of these groups that are leaving the PEO are looking for guaranteed savings, and that's something we can deliver. So that's built into those premium equivalent rates that we shared. The cost for both the difference card administration and that reinsurance component are built into the overall net savings that we shared. Just a logistical question that came up here. Can you share this presentation or the 4-step process slide? And yes, as a follow-up, we're going to share the recording and the presentation. And then if you'd like to set up some one-on-one time with us, we certainly can do that as a follow-up. Paul, there's a question here on the HR side that has come up a few times. I think there's 2 or 3 questions regarding HR outsourcing. What happens, right, if the group is using the PEO for those HR outsourcing services? What's your recommendation when they leave the PEO if they still need help with HR outsourcing?
Yeah, it's a good question. It's on our checklist, and in our analysis, we try to identify that early, right? So I know, so I don't know if you want me to name specific names, Chris, but I mean, I could do it offline, but yeah, we do work with a company that that does like ASO, tactical and strategic HR support. We plug in like very nicely as well, but we probably prefer to, you know, farm that out just because from a capacity perspective. But yeah, so a lot of times, so let me put it this way, like ADP, Total Source, PEO, right? They're probably the best sales reps in the country are ADP Comp Services, which are the sales reps that are taking people out of PEOs. So, and my point is that they charge a very expensive ASO fee to soften the landing of coming out of the PEO, so to speak. So we could do the same thing. Like all you brokers can do the same thing, sort of mimic that model, that sort of that talk track in terms of, hey, here's the payroll, the HCMS platform cost, whether it's $20 or $25 per employee per month, whatever the client's signing up for, right? And then you tack on an additional ASO fee, and we usually spell out what tactical services they're getting, and then if there's any strategic HR, you know, if they actually need a handbook created, if they need an onboarding, paid time off policies, I didn't talk about that, but if they need those policies developed, depending on the states that they're in, yes. So I guess that was a long-winded answer. Sorry about that.
No, that's good. That's great detail. Next question, Paul, is regarding the coordination of the payroll with ADP. Does that work fall on the broker, or is Payroll Mart handling that? And if Payroll Mart is handling it, how are you getting compensated for that?
Yeah, we handle that, and we have a wholesale agreement. So the payroll companies that we work with, we have wholesale agreements set up. So that's how we get paid. So it doesn't come out of, so whether they go to us, whether they have us involved or they go direct, they're paying the same cost, but it benefits them to have us involved because it's cost neutral, relatively. I mean, I'd say 99% of the time, and then they get us to manage that process so that it doesn't fall on the broker's lap.
And I remember that during the case study of this actual group that we wrote together, that broker was not a payroll expert and they needed that help. So rather than just have the PEO rep or the payroll rep be the one handling that transition, just having Paul as an intermediary who is a third party, not related to that specific payroll company, I think was really important for that customer.
Yeah, and to that point, the mindset of a payroll sales rep. So all of you on this call probably have a friend or someone that refer payroll business to. But they're not necessarily built or programmed to get into that into that much minutia as we are, sort of in that 4-step process. It's just not in their DNA, and that's not who you want to put your client sort of your client with them to handle the implementation, because they're going to be off to the next sale. We don't. We stay involved and manage it.
All right, very good. Another related question, does the analysis include the fixed costs of payroll? Like, are we building that back in when we're showing this net savings?
Yeah. Yes, we are.
Yeah, so the cost for the payroll is included. And then I've worked with Paul in situations where we do have to bring in an outsourced HR company to do that on a separate basis to handle the HR. We also will build that in and show the customer, here's the total net savings, leaving the PEO, even adding back in that HR outsourcing company.
Yeah, because I mean, just to expand on that, even the payroll, full payroll HR bundle plus ASO HR support, you may be at $40, $50, $60 per employee per month. But we didn't have to charge an extra ASO for that case study, first of all. And if you build in the SUI savings plus the admin savings plus the workers' comp savings plus the health insurance savings, the client was still way ahead.
Absolutely. There's a lot of fat in there built in. And even with that all built in and factored in, you've got a lot of net savings for these customers. All right, Paul, I think we've got time for 2 more questions. One, this is similar to the 401k side. If you need help on the workers' comp, Paul, do you have someone that can help them out on workers' comp?
Yeah. We're not licensed in workers' comp, but we have a wholesaler that would work, that could obtain quotes and place the business and set it up on a pay-as-you-go. Absolutely. Yep.
All right. And then last question, do you have a checklist with topics that you recommend, Paul, as you're pulling them out of a PEO?
Yeah, we do have a checklist. So I don't, you have to talk to me first before I give you the checklist. But yes, I definitely will share the checklist with you.
All right, very good. Well, why don't we end it there? Appreciate you all taking some time to learn about how to exit a PEO with us. Cheers. Diane, thank you for the cocktail demonstration. I think everybody enjoyed that too. Paul, great job. And we will send a follow-up email for anyone that wants to learn more. Here is the contact information. We look forward to talk to you all soon.